So, let's talk about something that is positive. There's this new study has found that the HPV vaccine cut cervical cancer rates among women by nearly 90%. Those are good numbers, Dr. Mike. My God.
You know what? Talk about the power of vaccines. This is an example, folks. 87% reduction in the incidence of cervical cancer in women. This was a UK study. Now, this was one of the early vaccines. We now have even better vaccines that cover even more strains of human papillomavirus, which is a big deal when it comes to cervical cancer and even throat cancer in men. So my boy, Nicholas, he's 13. He got vaccinated. Daughter's 10. She's going to get hers. Done.
Okay, just say that again to me. We're getting some new information from the... Okay. Do you know that story we did about the aromatherapy sprays?
Yeah.
And Dr. Oz was on talking about it. What's new about that?
Well, they're expanding the numbers of products out there.
They're recalled.
Now, this is a bacteria. It's melioidosis, and it's very, very common in Southeast Asia and Northern Australia. And somehow it got into these products. These are aromatherapy products. Now, the problem with this, it can be deadly and cause sepsis if not caught early. It's treatable with antibiotics. But the bottom line is we see a few cases of this from time to time. But this is something that you need to be aware of, especially when you're using any kind of natural product stuff like this. You need to be aware it doesn't go through the same scrutiny.
Earlier this week, we talked about the UK coming up with a COVID pill, and I was screaming, going, "When do we get it? When do we get it? Why did it go away? Why did it go away? Didn't Pfizer just announce something about a pill?"
Yeah.
All right. We'll talk about the UK first, and then get the breaking news about this. The UK has a pill for COVID-19. That doesn't replace vaccine, though, does it?
No, it adds to the armamentarium, especially for people like me. So if you were to get COVID, right, and you're not sick enough that you have to be in the hospital, I can give you a pill now that dramatically reduces your risk of getting, dying and going into the hospital.
It sounds like Tamiflu.
That's exactly right.
Oh, okay.
There you go.
Yes, it's an antiviral, and it will allow people like me in primary care to be able to treat people.
Well, we want it here. We want it here in the United States.
Well, it's coming. They're looking at it. Remember, you must deal with things in a systematic, scientific way.
All right. Alex, we talked about the test to stay at Garnet
Yes.
Valley.
What are your thoughts on this new effort? Because they want to be able to keep kids, even if you've been exposed and you're asymptomatic, they're trying to keep kids in school.
Right. Well, look, the bottom line is that if you can test kids with these rapid tests, that may be a way to go. The way we're going to solve this is by kids getting vaccinated. I really believe that is the answer. But for now, this is a novel way of dealing with it because you don't want to keep kids home. We must get our kids to go back to school, stay in school. And this might be a viable option. So if a kid is in school and comes down with COVID, they stay home, all right, for the quarantine. But what these kids are doing, what they're studying, is kids that are exposed to them in close contact.
All right,
get tested daily.
Let's get back to the breaking news now because we talked about the UK and the pill. Pfizer has just announced its experimental COVID pill cut hospitalization and death by 90%. So now they need to seek authorization. That could be fast, right?
It can. But remember, we want to do things in a way, Michael and Alex, that shows that it's safe and effective. We don't want to just jump because we think something works, like hydroxychloroquine, all that stuff. You all know that. We have to trust the scientific process. That's what we're doing, and hopefully this will be out soon, and it will again be another part of the way to deal with COVID.
But it's not a vaccine.
It's a pill. And what you do with the pill is it allows people like me to call CVS or Rite Aid or Walgreens or whatever.
Just like a prescription when you're
Yeah.
sick.
Exactly.
I have COVID. Can you help
Right,
me?
as opposed to monoclonal antibodies, which are infused, and you have remdesivir, which is an IV, and dexamethasone. That's for the people that are really, really sick.
So it can simplify
Right.
and give more access.
Take-home message, get your vaccine, get boosted if you're a candidate, and you will be okay. Going to have
Have a great weekend.
Listen, turn your clocks back. I hate this, by the way. I don't like it. I don't agree with daylight saving time stuff because it really affects people's seasonal affective disorder as well as causing accidents, depression, all of that.
Why in the hell did that ever get started? It was for farmers could get their wheat in or something, didn't it?
Don't you farm the land?
I need to get my corn in. I need more daylight.
My crops were fair to middling.
Thank you, Dr. Mike.
Thank you.
Hey, coming up,